Thank you for having me, Sue, and thank you all for attending today. My name is Michelle Lantaigne. I'm an occupational therapist at Baystate Rehabilitation Care in our Springfield location. And today we're going to be doing some home exercises for the upper extremity after having a stroke. Before we get to the exercises, I'd like to spend a little bit of time defining why we're choosing these exercises, why things are a little bit hard after we've had a stroke. So obviously we're going to start with the definition of having a stroke. But I'm a little stuck. Hold on. All right. The definition of a stroke: damage to the brain from interruption of its blood supply by either a blood clot or blockage or rupture in a blood vessel that causes the brain not to have enough blood and oxygen, and the brain cells that are affected die. So this has already happened to people who are here who are looking for some exercises. You know, some deficits that come from the upper body are sometimes it's weakness, sometimes it's decreased sensation, sometimes it's decreased coordination, problems with muscle control, abnormal tone or spasticity. And I'll be talking about like tone and spasticity today. What we do is on our bodies to move is we have a normal everyday movement pattern that involves muscle tone. That's how we activate certain muscles, how we get a little bit stronger. Sometimes when you have a stroke, you have either flaccid muscle tone, meaning that the muscles are super loose, they don't want to contract, or you have spastic muscle tone. And that we would refer to as higher tone. It's when you have spasticity or involuntary muscle control that causes a lot of tightness. So some people, when they yawn, their arm gets a little bit tight and that pulls up. Or some people, when they go to do something, it ends up being too strong. And that would be a higher tone situation. And we'll go over some things that we can do for either of those situations as we do some exercises. Another deficit that people can have after having a stroke is pain. Now, certainly, as we're going through some stretches and exercises in a couple of minutes, I don't want anyone to do anything that causes pain. A little bit of movement is good, and a little bit of feeling the muscles move is an excellent thing, but we don't want anything that causes pain. Pain means that it's your body's way of telling you that it's moving too far or that there's too much going on and you need to stop that motion. So anything we do today should not be done in an environment that is not safe, and it should not be something that hurts you. All right. All right. So as an occupational therapist, my job focuses on activities of daily living. Now, the first things that we usually work on with patients are those activities such as eating, which include feeding yourself, being able to cut your meals with a utensil, being able to hold a cup of water or a water bottle and bring it to your mouth and take a drink. Opening containers, opening Ziploc bags, which are really hard if you have a weak or sometimes an arm that doesn't work the way that you want it to. Dressing, break it all down. It's reaching overhead. It's putting an arm through a sleeve. It's bending over and getting your legs into your pants. It's pulling them up. It's doing the zippers and buttons. It's getting those socks and shoes on, which are the hardest thing to do for everybody. Taking a shower, washing your hair, holding on to different objects, opening your lids for your shampoo, conditioner. All of those things involve a lot of your upper extremity. And sometimes when you start to learn about after having a stroke is that you learn how to compensate. So, they teach you use the pump to hold on to to get soap or shampoo or conditioner so you can wash your own hair. I don't want you to stop doing those things. I just want you to think about the ways that you've compensated a little bit because somebody's had a stroke. Grooming, brushing your hair, holding your toothbrush and brushing your teeth, being able to shave, put makeup on, all of those things involve a lot of upper extremity movement. And of course, mobility. Now, people think mobility just involves legs. Well, it certainly does not. Being able to reach back, push off a chair to stand up, being able to hold a cane or a walker so that you can ambulate a little bit safer if you need a device. Some people have to use devices to help them to keep them from tripping, such as an ankle foot orthosis. Putting all those things on requires your upper extremity so you could use them. And further along is our instrumental activities of daily living, or IADLs. All the things we do to take care of our homes and to take care of ourselves that aren't just your activities of daily living. So making a meal, cleaning up, doing your laundry, managing your finances, Our ideals also include things that you like to do, like going for walks, going out to lunch with your friends, being able to manage your own medications and your schedules for your appointments, working. Any other role in your life could involve an IADL, such as being a grandparent, a parent, a caregiver, a community member, any things that you like to do for volunteer work. These are all things that we want you to start to regain as you've been home after having a stroke. My biggest thing that I want you to learn about by coming to this class today is we want to avoid what's called learned disuse. This occurs when a person suppresses the use of the affected limb after having a stroke because it has an impaired movement. So you learn those compensatory techniques. It's for your own self-preservation and your independence. So instead of writing with your right hand, some people learn how to make an X and sign with your left hand. Some people decide to just eat with your left hand. All those strategies are good for regaining your independence, but what it does foster is some learned disuse. So it's creating a balance between both. While we work on some of these exercises today, I'm also going to give you components of things that you can do functionally so that you can give the upper extremity, or your arm or hand, something to do. Because if you have a purpose and something to do with that arm, you're more likely to use it. And that's what we want to avoid is to not use that arm. We don't want you to do that on a regular basis. We want you to have a purpose with what you're doing. So again, how can we prevent or change this? Well, we can do exercise. We can give us a specific job that we make this arm do. If we work on today, you being able to reach your chin, well, the goal would be to be able to eat a cracker or a chip or a pretzel with that hand. If you could hold on to something, sometimes you can't. So maybe you need to be able to help yourself have a drink. Maybe you need to be able to hold something while you're walking and try to see if your body will remember how to use it. We need to give our arm to some tasks. And the best way to do that is to make it part of our routine every day. So if we work on something today and you're like, oh, I didn't really think about that. Sometimes, even if it's your non-dominant hand, you have to make it that hand's job, such as brushing your teeth or making sure that you open or turn on the water with the hand that's affected, even if it's your non-dominant hand, because the best way for you to regain that function is by using it. So I'm going to stop sharing what I have here and we're going to start into exercises. So what we're going to start with is a lot of our hand function starts from the strength in our shoulders. If you've had therapy before, you know we always focus on our shoulders. So the first things that I think that we should work on is shoulder shrugging. Now, it seems simple, but it's not. What we're going to do, we're going to start with doing this exercise. Take your shoulders. You should be sitting flat with your feet flat on the ground with a chair with a back support if you have one. What I want you to do is shrug your shoulders up to your ears, and you're going to hold it. 1, 2, and down. That was number 1. We're going to do it again. Up, 1, 2, down. 2, up, 1, 2, down. 3, up, 1, 2, down. 4, up, 1, 2, down. 5, up, 1, 2, down. That was 6. Ready? I know you're probably getting tired. Keep going. Up, 1, 2, 7. Up, 1, 2, 8. 2 more. Up, 1, 2, 9. One more time. Up, 1, 2, 10. All right. So that I'm just doing sets of 10 of all these exercises. So you can either follow with me, see how it feels. Now, some people can't do that all the way by themselves. It doesn't matter if it's not perfect with both arms. What you can do is I'm going to try to do this with my screen. If your arm is very weak, you can hold on to your other arm and help yourself with your good arm. But I want to make sure that you're trying the best you can. If it doesn't go all the way up, it's okay. Do those exercises. If you like some of these exercises, later you'll be able to come back to our site and do them again with me. All right? So the next thing I want to work on is your scapula. So your shoulder is made up of your humerus, your clavicle, and your scapula. It's 3 bones. What we're trying to do right now is to make sure all of those components are working together, and that will create a good, strong, solid foundation of your shoulder. And the reason why we want to do this is because we want to be able to reach for things, and we need everything to work together. So we're just waking up the muscles before we use them. So I'm going to turn around and I'm going to show you the next exercise. The next exercise I want you doing is you're going to sit up nice and tall. You're not leaning against anything. Squeeze your shoulder blades together. So when you squeeze your shoulder blades together, you're trying to meet these 2 bones together the best that you can, and you're going to hold them for 2 seconds and relax. Okay? What you can do with your arms is you can kind of keep them close to your side. You want those elbows close into you. And try to squeeze together. Hold 1, 2, and down. That's number 2. Ready? Let's do it again. Squeeze 1, 2, and down. That's 3. Squeeze 1, 2, down. That's 4. Squeeze 1, 2, down. That's 5. Again. Squeeze 1, 2, down. That's 6. Squeeze 1, 2, down. That's 7. 3 more. Squeeze 1, 2, down. That's 8. Squeeze 1, 2, down. That's 9. And squeeze 1, 2, down. That's 10. Now, if your arms are weak and that's really hard for you to do 5. Rest and then try to do 5 more. All right. I usually tell people to do, if you can do those, each of those 2 exercises, I want you to do 2 to 3 sets of 10 a day. That will really help get that arm waking up and stabilize your shoulder. Now, some people are going to look at me and say, well, my shoulder's fine. It's just my hand. Well, you cannot do anything with your hand unless you have stability in your shoulder. So your arm may stay weak and you may not get a better grip strength until that shoulder is stabilized. So I assure you, some of these exercises will apply to those who have higher functioning as well. All right. So we're still staying with the shoulder. The next thing I want people to do is I'm going to get a towel and I'm going to use this plinth here as a table. So if you're at a table or if you have one at home, you can watch this. If it's in front of you, you can certainly participate right now. All right. So I am taking this towel right here. I'm facing my table. All right. Now we're going to pretend that my right hand, that way you can see me a little bit better. Put your right hand on the table. And what you're going to do is you're going to reach forward, straighten that elbow, lean forward, and then come back. The reason why I'm having you lean forward first is to work on that stretch of that shoulder. If you can't pick up your arm, sometimes leaning into a table will help you get more range of motion. We're going to do that 10 times, nice and easy. If you cannot push your arm all the way by yourself, you can certainly use your other arm to help you. Put one hand on top of the other and push it this way. This is usually, if people have had any kind of therapy, one of the first things that we start with. So let's do 10 of those together. Ready? Here we go. 1, back. 2, back. Make sure that you're pushing down so your arm doesn't go flying or off the towel. Push again, 3. Good job. And 4. Good. Push again, 5. And again, 6. 7. 8. 9. And 10. All right. Now that was really to work on that stretch in our arm up through your scapula and up in that shoulder. Now, if that's something that's really easy for you, what I want you to do is the same thing, except don't lean into it with your body. I want you to go as far as you can. Do it straight out. So you're just moving your hand, not your body. The stretch is good to start with, but then for more exercise, push out and in 10 times. Okay? Now, if that's super hard for you, again, one hand on top of the other. Another thing that you can do is link both hands together. And you can do it like this, straight out in front of you. Push it out and up. 2, 3, And forward. Again, that's just to work on the shoulder. So those are things that you can do to work on that shoulder strength. As those things get a little bit easier for you, we can move into different kinds of movement. You can use the table and you can go in and out. Now, you don't need to lean for this one. The goal would be to be able to move your arm. Now, if you can reach with your hand and keep that hand straight, go ahead. Really work that shoulder by keeping that elbow straight. If that's really hard for you to do, you can get closer to the table. And what you're going to try to do is pull it into you. And sometimes you have to help push it away from you. Pull it into you, push it away. Ready? Pull it into you and try to push it away. All we want to do is really stimulate your body to start working with you so you can start moving that arm. Okay? Now, we're going to move up a little bit so it's a little bit harder. The next activity we're going to do, the thing that we do need is a cane or a light broom or any kind of like dowel or stick that you might have. So I have a cane right here. Just so I happen to have this in my gym. All right, so what we're going to do next is the next exercise. It's working on your elbows and your shoulders. Is a chest press. So what we want you to do next is push it out and in. Out and in. 2, 3, 4, 5, 6, 7, 8, 9, one more, 10. And like I talked about before, if that's too hard, you can hold on to 2 hands and do it this way. So you're really helping straighten out that arm. What we want you to do is lock out that elbow right there. The goal is to be able to push things away from you. All right? Those are 2 modifications, things you can do. Now, the next component is what we talked about. How is this functional? What can we do that's functional? What do we do that we train ourselves to do this activity with? So things that you do is reaching for things in a cabinet, reaching for your toothbrush, reaching to turn on and off the sink. So I want you to think about those functional components that we do that will make it practical. So if that's something that you do, reach, turn on the faucet, turn it off and back. You can work that into your daily activity. Every time you go to the bathroom, reach with that arm, turn on the faucet and turn it off. Okay? That's one thing you can do. Another thing you can do to make it harder for you, so you can build a little bit more strength, get some groceries, your grocery items. You can pick up a can that you have in the house or a light box of rice, anything that you happen to have laying around that isn't too hard for you to hold. And you can pick it up, put it on a higher surface. So sometimes I tell people, get a box. Sometimes we have those shipping boxes, or put a pile of books up, and you can reach and put your things on those shelves and take them down. That's an exercise and it's functional. So not only do you have to work to put away groceries, you can do that over and over again at home. It's another way to build some strength, and it's purposeful. We want you to use those things. Sometimes these are too heavy. You can grab a piece of fruit, put it in a bucket. Those are some activities that you can do at home that really work on that shoulder. Okay? So as we're getting closer to the hands, we're going to start working on the elbows. Obviously, we just kind of did a little bit of this. We're going to take that cane again. And I want you to go up to your shoulders and down to your knees. Okay? Let's do that 10 times. 1, 2, good. 3, 4, 5, 6, make sure you're breathing. 7, we often hold our breaths when we're working hard. 8, 9, good. And 10. Beautiful job. So ideally what I'd have you do is to do 2 more sets of 10. Now, that's only if this is effortful for you. That means that you're working hard to try to pull those arms up. That's great. It's great work. Keep doing those things. If that's too hard, hold on with your other hand, bring it up to your chin and down to your lap. Up and down. You can help yourself. But while you're helping yourself, don't just move your arm around. That's not doing anything. What I want you to do is try really hard and have the other hand help you the rest of the way. Pull it up and help yourself. The goal is for you to be able to do something functional, like reach your mouth, like reach your head and itch your head, things of that sort. So work that arm, make it do the job by itself if you can't quite move it all by yourself. If that's too easy, you can take your cane and you can get a weight from a local store and wrap it around here if you'd like to. Or you can take a soup can. It's about a pound if it's 16 ounces. You can take a water bottle if you have one at home. And what we want you to do is you can do bicep curls like this. Do it on the arm that is weaker. Build some strength in there. Because when we build strength, we'll be able to use it a little bit more. You can do those about 10 times. Then, again, we're going to talk about that functional component. What I want you to do, grab a water bottle, bring it up to your chin, bring it up to your mouth. Okay? Now, I took out some of the water in here. If it's too heavy, you can take more out. If it's too light, fill it up to the top. Now, eventually, your goal functionally is to be able to have the lid off and drink from it. Now, people are always poo-pooing that a little bit because when you go to take a drink, sometimes it's a mess. Well, you can get those sports water bottle tops. You can get a straw, but I want you to have like a functional reach in there and try to reach up to your mouth so you can actually use it for a purpose. I want you to be able to take a drink. We need to drink lots of water. We need to make sure that we're breathing. We need to take care of ourselves. So that's a great way for us to do this. Working our biceps builds that muscle. So when you have something that you can do with your hand at some point, you have the power. Our biceps are our powerhouses. It's where we'd be able to hold things and pick them up. So another functional component is to be able to hold a water bottle and walk around the house. Grab a bag of groceries. Certainly don't try to hold something that's too heavy. Try to get something that's non-breakable, and something that's not too heavy for when you grasp it. So I suggest using those reusable bags that are more fabric versus paper bags. All right. Giving that arm a job and having it do something for you is the way that you're going to be able to incorporate it into your daily life. All right. So as we get closer to the hand, some of these activities are a little bit more complex. So we're going to work on the forearm. All right. What can we do to work on our forearm so we can turn it over? Some people are able to grasp things and put them down. And some people would have a really hard time doing that. So what we're going to do next is we are going to grab, if you happen to have some cups at home, I want you to try to grab a bunch of cups. Now, I don't want them to be glass cups. So if you don't have them, you can use paper. Or if you're super lucky and you have some plastic cups, that's great too. I'm going to put out some cups onto a table. All right, I put out about 5 of them. All right. So if you're able to hold things with your hand, then you can work on the forearm. If not, you have to kind of work with it with yourself. Okay. That's something that you can do on your own. You can try to do that. Try to turn your hand palm towards you, palm away, palm towards you, palm away. If you're able to use your hand a little bit more, I want you to pick up a cup and you're going to turn it all over so it's lid side down. All right. Grasp that, turn it over. So you can see it's not just my forearm. I'm using kind of my whole shoulder, which is another way that you can use that shoulder and give it a little bit more strength. You're going to kind of use if you find that you're doing it like this, that's okay. Turn your whole body. But the goal is for you to be able to do it this way. So you're going to use your elbow and your forearm to turn it over. All right. I just did 5 of those. Now, certainly it's like this. I can't turn them back over the same way. It seems really weird. So what I'll do is I'm going to turn my arm over, grasp them, and turn it back over right side up. Okay. Let's do 5 of those. Grasp, turn it over. Grasp, turn it over. Good. Grasp, turn it over. Grasp, turn it over. Nice job. All right. Again, a functional component. Well, this is functional. Being able to turn over cups, be able to put cups away in the cabinet, be able to turn a cup over, empty out the water. So it's another thing that you can do. If you have a cup of water, you can pour it out into the sink. All right. We're going to stay with the forearm. I'm going to give you another idea of things that you can do. Grasp, if you happen to have a deck of cards, it's a great way to do this at home. If you don't have cards, you can use paper, index cards, anything that you have lying around the house. This way we'll be able to work on your hand a little bit more. So we're working on your forearm, but you're also going to use a lot of your fingers. So if this is too hard to do, you don't have to do this part. Work on the cups longer. Do a double session of those things until you grasp these things. So I'm going to grab a deck of cards. All right. So the motion that we were just working with is called supination and pronation. So sup like you're carrying soup and pronation like you're going down. All right. So what we're going to work on next is I'm going to hold a deck of cards. And if you can hold them with your good hand. And if you need a little bit of help picking up the cards, you can use your good hand to kind of give you one at a time. What I want you to do is you're going to grasp the cards. My hand is palm down. And then I'm going to turn them over onto the table, palm up. Okay. So I'm going to do those for the whole deck. So giving myself the card, palm down, palm up. I'm not going to do the whole deck. That's 52. That's too many. Palm down, palm up, palm down, palm up. This is a really hard thing to do. If this is too slippery, you can do something with a little more grit, like a thicker piece of paper. And you can also just work on moving that hand palm down, palm up. But this kind of gives you like an ending. So if you do 52 of these, that's 52 repetitions that you've done for an exercise. That's fantastic. And then if you really want to do something functional, you should play a card game with a loved one or somebody coming to visit you. It's a great way to do things. All right. So let's move on to the hand. All right. So most people have questions about how to make their fine motor skills better. Everybody heals at an individual level. Some people are able to do things more, some are less. But remember, the whole arm works together. So we're going to start with the hand right here. And I'm starting with a very basic thing that you can do. All right. Now, if you don't have a lot of motion in your hand, the first thing you're going to work with is trying to squeeze and open. So I'm helping myself squeeze and bring those fingers in. That's 1. And open it up. 2. 3. 4. 5. 6. 7. 8. 9. And the reason why I move so slowly when I'm doing those things is because you want it to be purposeful while you're moving. You want to make sure that you're participating in the activation of those muscles. Picture it in your head. If your hand's really weak, we want you to be able to do those things. Now, if you're starting to be able to move your hand, but when you go to move it and squeeze it, it gets really, really tight. What I want you to do is make sure you open up the fingers as much as you can. Sometimes you need to stretch that thumb out to the side to be able to open it up a little bit more. You can do this palm up, or you can also do it sideways. You can open up your fingers, open for thumb so you can stretch out that hand. Okay, so since we're working on active grasping, I'm going to do one of my favorite activities so people can participate. It's scrunching up a face cloth. So I'm going to turn my camera so you can see this. We are taking a face cloth flat. I'm putting my hand on top. And what I want you to do is you're going to scrunch the whole thing up so it's all in your hand. And squeeze. And then I want you to put it down and push open with your fingers. The pushing open is as important as the squeezing is because you want to work on the balance of your muscles. Your squeezing works on this side and your opening of the muscles, your extensors are on the back side of your hand. Often the extensors, because they're smaller muscles, are harder to rehabilitate. So pushing open is so important. Let's do that together 10 times. So I want you to squeeze, squeeze, and open. All right, that's number 2. See, I'm working on pushing it all the way open. Again, squeeze, get the whole thing in your hand and push it open. That's number 3. Squeeze and push it open. That's 4. Squeeze and push it open. 5. Squeeze again and push it open. 6. Squeeze and push it open. 7. Squeeze and push it open. 8. 2 more. Squeeze and push it open. 9. Last one. Give it a good one. Squeeze and push it open. Nice job. All right. So there are some more things you can do with the face cloth that will help build the strength in your hands. Another component you can do is you can roll up a face cloth like this. And if your hand is weak, put it in your palm and work on squeezing. Work on seeing those fingers move a little bit. You can do that 10 times. Now, if you're much stronger than that and you can activate that squeeze component pretty good, you can do it on the table. What I want you to do is you're going to take a little bowl of water and an empty bowl of water. Put a little bit of water in there, and I want you to fill up that face cloth and then squeeze the water into the empty container. And you can get it so you can get all the water from one to the other. Because this way, if you're able to activate that squeezing, you're working on building some strength in there. You could even just grab a sponge and do it the same way. Or you can hold it and wring out a face cloth. That also builds a lot more strength in your hand. And it makes you move your wrists a little bit more too. All right. So we're going to go more advanced to more activities that you can do if you have to work on some of your fine motor skills. Now, what I want you to try to do first is to start working on touching each finger to your thumb. This is called opposition. We want you to be able to do this as much as you can. Now, if you can feel your fingers, that's fantastic. A lot of people who've had a stroke have impaired sensation, so this feels a little bit funny. You should be able to do it while looking at your hand. And the goal is to be able to do it when you're not looking at your hand. That's hard. That is a very hard thing to do. So start with doing those things, okay? Then if you're going to be really fancy, you can touch your finger and move it down to your base of the finger. So fingertip all the way down. Fingertip all the way down. We work on those skills so you can work on your thumb. Our thumb does a lot to support your hand in fine motor activities. All right, things that you can do at home to work on those fine motor skills. Grab some coins, empty your purse, empty your catch-all, where all your change is, if people still have that. You could also use buttons. You could use paper clips, small objects that you have at home. So I'm going to use a bunch of change. I'm going to put it on my table. I promise I'll show you. All right. So what I did is I took an old piece of plastic Tupperware and I cut a hole in it. And that's what I'm giving as my job. If you have a hard time with your fine motor skills, you do not need to use a slot. You can just use an empty cup. What you can do first is your goal is to pick them up. You should use your thumb and your pointer finger and put them in. Now, that's a hard thing to do. That's called a tip pinch. I want you to pinch and put them in. Pinch and put them in. Now, certainly the quarters are easier because they're a little bit bigger, and the dimes are more difficult because they're very small. Okay? You're working on that tip pinch and putting them in. Now, if that gets easier and you have a little bit more hand control, tip pinch and put it into the slot. That's making your whole arm work a little bit more. Pinch, put it into the slot. Pinch, put it into the slot. Now, if that's a very hard thing to do, some people have to have it into their fingers by the other hand. Now, you could put it into these two fingers if you can oppose those ones. If you cannot, you can use your thumb. If you have a little bit of movement in your thumb, some people, this is called a lateral pinch or a key pinch. You can pinch it with your thumb on top and use your whole arm and put it into the slot or just open it into the cup. Okay, so we'll do that together. I'm going to show you. Thumb, pinch with your thumb, turn it and put it into the cup. Pinch it, put it into the cup. Pinch, put it into your cup. Again, you can make it harder by making a slot. You can also make the slot really small, so you have to push it in, and that would build some strength in your fingertips. All right. So you can do that with a lot of different small objects that you might have in a junk drawer. Just cleaning out your junk drawer is a good way for you to use those tip pitches and sorting things. You can pick up your pens and turn them all the same way. You can do all these small components to develop your skills into your hand. Now, another thing that you can work on is being able to have it pinched and then put it into your palm. That's a really hard skill to do. Pinch, put it in your palm. Now, again, if coins are too small, try something bigger. Try larger buttons. Some people have poker chips laying around the house. Those things are bigger. You can use bigger blocks or something that you can hold into your hand. It doesn't matter how you do it, as long as that you're trying to move it at home. And again, this is a good functional component because you can practice putting coins into a piggy bank. You can practice sorting and rolling your coins. I hope today was helpful for most people. My goal was to give you some functional activities of things that you could do with these exercises. I'm definitely going to open it up to the chat. If anyone has any questions or things that they would like to try doing.
Thank you, Michelle. That was really great. I was riveted watching you. You're such a great, you are in a great position for your skills because, not only are you mesmerizing to watch, but you really give clear instructions, and I appreciate your work.
Thank you so much.
Yes. If anybody has any questions for Michelle, you can type them into the Q&A box here, and she'll be happy to address them. We'll give everybody just a couple of minutes and we'll hang out here to see if there's any questions.
Absolutely.
Right.
Thank you all so much for participating today or just coming and listening to some of the ideas of things that we have. I really appreciate it.
Oh, Anne,
that was so nice of you.
Let's read that so the audience knows. So Anne doesn't have a question.
Anne wrote, "Thank you so much for helpful work projects." Thank you, Anne. I really want people to try to use their hands, come up with things. If you're a crafter, use those fingertips any way that you can. I want you guys moving as much as possible. It's not easy. Things are different after having a stroke. So thank you, Anne.
If folks want to watch this presentation again, maybe they didn't have a face cloth handy or whatever while you were doing that it is recorded, and we will be posting it on our website, and it will be on our YouTube channel, youtube.com/Baystate Health. So people can view it again.
Absolutely. And I should also say that your therapy is never really over. You should consistently be working on how to exercise, take care of your bodies, and feel free to ask for help when you need it. If you need to go and have a tune-up for therapy, there are therapy places in the area. I know Baystate Rehab has a ton in the area, and specifically in our Springfield location, we're stroke specialists. So we have a clinic with physical therapists, occupational therapists, and speech therapists. We work in a multidisciplinary area where we are able to service that population.
Oh, it's great that you mentioned that. Well, it looks like there isn't any questions because you covered everything so brilliantly.
Oh, thank you.
So thank you to the audience, and thank you to you, Michelle, for really a great presentation. We appreciate you.
Thank you. Everyone have a good night.